I am Dr. Ruben Basu. Today's topic is understanding cholesterol management. The first question comes to you, what is cholesterol? It is an essential component of the blood, cells and body tissues. Almost every cell of the body needs cholesterol to function normally. So, cholesterol is essential, is an essential molecule. There are different things like hormones, vitamin D, bile acids, and helps in digestion of fat. That is not doesn't matter. But the main thing is this body, our body needs cholesterol for maintaining normal mechanism. But the level should be in a range. Excess cholesterol is harmful. So the next thing comes, how cholesterol is going about all around in our body. This is a very interesting phenomena because blood, our blood is basically watery base, watery in nature, and cholesterol is fatty in nature. And it is a common thing how water base and the fat base will go on together. That's why the mechanism is being created by God. Cholesterol is being circulated as lipoprotein, lipid core inside and the protein core outside. So it is lipoprotein. There are two types of lipoprotein in our body. One is low density lipoprotein, which is harmful. Another one is high density lipoprotein, that is the beneficial for our body. Now, you must ask question, how percentage the LDL and HDL moves? Mainly the LDL is the major percentage and the HDL, the high density, the good one, is the lesser percentage. In our body there is another molecule known as triglyceride. They come from food and the body also makes them. Now, how to assess our status of cholesterol, triglyceride, HDL, everything. So I think by far lipid profile is the only pathological parameters, and it has been upgraded by now. Lipoprotein A in some, I preferably prescribe lipid profile with LPA. This is a better marker than lipid profile, and the best marker is, ApoA, ApoB ratio. What is Apo? Apo is an apoprotein, the protein layer. And so, you have to measure the protein layer, and the range of total cholesterol should be around 200. LDL should be around 100, but World Health Organization has put very strong stress on LDL. They have asked to cut down the level to 70. So what are the measures? There are various measures: statins, bile acid sequestrants, the nicotinic acids, but there are various side effects, the fibrates, and the cholesterol absorption inhibitors. But by far the best is statins. And what I prefer the history taking. When a person comes to you, the most of the person in a family history of coronary artery disease or stroke or something like that, because cholesterol deposits as the blood flows through the branches and the sub-branches of the blood vessels, the hits, and there is atheromatous plaque. And this atheromatous plaque gets dislodged or hampers the circulation and creates stroke in the brain or heart attack in the heart or renal compromise. So we have to be very alert regarding using of statins. I must tell, treat them early. Prevention is better than cure. So if there is history of coronary artery disease in the family, start early in the 20s and 30s. And so what are the measures? Is healthy eating. Healthy eating means you have to avoid the junk food. This is physically active. You have to walk and run, quit smoking, lose weight, limit alcohol, and stress-free life. The stress is a dangerous thing. You must keep all this point: healthy eating, physically active, quit smoking, limit alcohol, lose weight, and stress-free life. So I think I have, in a nutshell, covered something, just a glimpse, how to management cholesterol. So thank you very much for my this thing, and this is the typical part which I have to tell. But now in clinical practice, I have found some extra things that I want to share. I want to share you that it is a killer disease. So don't take it so lightly that cholesterol, okay, no problem. You must be very alert about this thing if there is family history of stroke, cardiac CAD or any kidney problem. So in the siblings or in the spouse or in any one member should have routine checkup of cholesterol, 6 months interval, sorry, or if there is typically any history of hypertension or any fluctuation of blood pressure, 3 months interval. So lipid profile with LPA every 3 months interval, along with precautionary measures of healthy lifestyles and physically active, no addiction, preferably alcohol and smoking, and stress-free life. And apart from that, if there is still the tendency of hypertension, then start statin early. I have found a patient. It is he is a 15 years of boy. He is very obese and he is taking 14 years of age. He is taking this antihypertensives ARB, angiotensin receptor blocker since now, and also statin, because I have no way. I can't leave that chap into danger fire in the next part of the life. So, in a nutshell, it is a killer disease. It can kill all the end organs and it can swipe out all the end organs when you don't know. It's all to the Almighty, Hare Krishna, whom I believe. So, I particularly want to convey my message. All of you must be very, very alert about your cholesterol status, means the lipid profile status, and consult your family physician, or you make out your chart, Google, and take it the advice from Google. By any means, you have to cut down these things and keep it under control. If you want to be a healthy, happy person in the later years of life, so start it from now and today. That is my message of today evening, and I don't want to progress anymore. Just I want to request all of my doctor colleagues and personnel, medical personnel, to take it give very importance to this cholesterol molecule, lipoproteins and triglycerides, and must be healthy and happy. That's all. Thank you.